Okay. And we are recording, so let's everybody keep it PG-13 today. Sometimes I do want to use R-rated language when I am talking about state government and the healthcare system, but I will do my best not to. My name is Jerry Katz. I use she and her pronouns. I live in Minneapolis, Minnesota. I worked with Rose for many, many years at the Minnesota Nurses Association, and a great deal of what I learned about healthcare policy I learned from Rose. But I also have 20 some years working in state government, lobbying and advocacy and political organizing. Still doing that for my current job now at Jewish Community Action. So I will just run you through kind of the 101 of how to be an effective grassroots lobbyist. So there we go. So our learning objectives for this training are, once you're finished with it, you will understand the legislative process and how to be engaged in it. You'll understand Healthcare Minnesota's priority bills. You'll be able to describe what influences elected officials and what doesn't. You'll plan an effective meeting with a legislator, and you'll prepare an elevator speech about your issue. I'm just checking on will we receive the list of talking points? Yes, you certainly will. Yeah, everyone that should feel comfortable to just kind of listen to the training, watch the training, and then you will be getting packets on the day of. So our next slide here, I'll start with State Legislature 101, and some of this will be review for many of you, but please bear with me. When a bill comes to the Minnesota State Legislature, it starts as an idea before it's ever introduced. Often it starts as an idea of a constituent, and that constituent goes to a legislator and says, I think this is a good bill, will you author it? Sometimes it's a lobbyist, sometimes it's someone from an organization, sometimes it's the legislator themselves that has the idea. So they do the research, they write up the bill, they work with the staff at the legislature to put it into all the correct legal frameworks, and they introduce it. It goes into the hopper, as they say at the Capitol. And then it presumably will go on to a committee hearing. But with the question of whether or not something gets a committee hearing depends on the leadership in the House or Senate at the time. So we have a House, we have a Senate. Each one has a leader. There's the House Speaker, there's the Senate Majority Leader. And then the committee chairs of all the different committees, they get to decide what moves or not. So you might think your bill making Twinkies the official snack cake of Minnesota is the greatest thing ever. But, the committee chair of I don't even know what committee that will go through. We'll call it state government. The chair of the state government committee would probably say, we don't have time for this. We're not going to hear the Twinkie bill. But you might have a really great bill that would create a state-based single-payer healthcare system, and the chair of the healthcare committee would say, wow, that's an awesome bill. We're going to hear it. So it really depends on who are the leaders in the committees of jurisdiction, who are the leaders of the two bodies, if a bill even gets heard. Once a bill is scheduled for a hearing, this is a great opportunity, again, for a grassroots lobbyist to get involved, where you go and meet with the legislators who sit on that committee. It's an opportunity to talk to them ahead of time and secure their votes. It's an opportunity for you to testify for the bill. You can also go and testify against bad bills at a committee hearing level. Then once it makes it through all its committee stops, and for some bills, the bigger and more complicated they are, the more committee stops they need, it goes on to a floor debate. And these are the things you usually see on TV, or if you're watching a webcast where they're all, standing on the floor and having these big impassioned debates. This is another opportunity for grassroots lobbyists to get engaged. You can, if you're going physically to the Capitol, you can stand outside the entrance to the chamber of either the House or Senate, so the actual lobby, and you can pull them out. You can send in notes via a page and ask them to come out and talk to you. Sometimes they will and sometimes they won't. That's lobbying. That is the basis of the word lobbying. And it's also, if you're watching from home, If you've got good Wi-Fi and a good internet connection, you can be emailing or texting your legislators. And if you're really on top of things, you can, they might use what you say in your message to them in a floor speech. So if you hear somebody say something and you're working, somebody says something about your bill to create a state-based single-payer healthcare plan, and they say, this will make it illegal for nurses to ever touch patients again. You'll write to your legislator and say that is patently untrue, and I can show you online, 1.25 where it says the opposite of that. And then your, legislator that you just sent that to will actually stand up and dispute what the other person just said, because you are the one that gave them that information. So that's floor debates. Then after it's gone to the floor, if it passes the floor in the House and it passes the floor in the Senate, then the two bills come together in a conference committee. Because along that pathway of going through all those committees and all those floor debates, they will have been amended along the way. And the likelihood is that by the time they both pass off of the floor, they are not identical anymore. And so the two companion bills meet up in the conference committee where members of the House and the Senate come together and kind of hammer out the differences between the two bills, make sure they match up. They go back for one more floor vote, and then if they pass, they go to the governor, where the governor has the opportunity to sign it or veto it. So again, opportunities for grassroots lobbyists to get involved and to advocate to the governor that he signed the bill or that he veto a bad bill. And then lastly, and we often, think, okay, we got it passed, we're done, let's have a party, comes the implementation stage. And that usually is going to be something that happens within an agency or agencies of the state government. And this can often be harder than even passing the bill. And so grassroots lobbyists and activists have to continue to work to make sure it gets implemented the way it was intended to be in the bill. We've seen it many times where the legislators are really clear about what they want, and then somehow in the implementation process, something funny happens and it doesn't get implemented the right way. So you got to stay on top of the implementation plan. So right now, we're in about almost the middle of session. Bills are still being introduced every day. The House has started having floor sessions, which is early. They're trying to move through a lot of bills to floor session right now while they have a temporary one-seat majority. There is a special election happening on March 11th, and it's quite likely that a DFLer will win that, and then the House will have a tie. So they're trying to do as much business as they can before that tie presumably comes back. So we'll move on here just quickly to what the political landscape is in Minnesota right now. There are 134 seats in the Minnesota House, and they temporarily have a one-seat majority. There are 67 seats in the Senate, and there is a one-seat DFL majority, and we have one DFL governor. And I think everybody knows not to make any assumptions based on party affiliation. Not every Democrat is going to automatically be on our side in terms of healthcare justice. So, those numbers are important, but don't assume anything because of someone's political party affiliation. Oops. All right. So this is a weird political landscape. There hasn't been a tie in a body of the legislature, I think, since the 60s. So it's a weird situation. So what this means is that it's going to be really hard to get anything passed. That little bit of power that the House GOP has means that it's going to be really difficult to get anything passed. On top of that, it is a budget year. I think you all probably seen some news about the budget outlook. It's not looking great. I think our small surplus from the November forecast is all but vanished by now, and we are projected to have a $6 billion shortfall in a few more years. So they're going to be proposing cuts. There was a lot of one-time money from the last biennium that won't get renewed. And then there's also the uncertainty of how cuts imposed by the Trump administration will affect the state budget. So we know that there's going to be some disruption, but it's really hard to budget based on what, the chaos that's happening in Washington. So that adds another layer of weirdness. But with the budget process, the governor, the House, and the Senate each create a sort of statewide budget. And then the House will do theirs, the Senate will do theirs, and then they will negotiate. And this is where, it's about the end of May. They are going back and forth, middle of the night, hammering out negotiations. It's really hard to know what's going to happen, but they usually go until the very last minute of session, if not longer. And if they can't arrive at an agreement by May 19th, they would have to go into a special session. So that's kind of the 101 about how things, the process works at the Capitol. So now we'll talk about the legislators, who are the people you'll be meeting with and influencing, hopefully. So just want to go over a little bit about what influences legislators. They are people, they are human beings just like all of us. And so they are influenced by their friends and colleagues, especially people they've known and trust, by their political party. So their parties each have very different, ideologies about things like healthcare and spending. And so that will influence them. Their voters do have an influence over them. Most of these people like being in office and want to stay in office, so they care at least a little bit about what their voters have to say, because you are their bosses and you are the only person with the ability to hire and fire them. They also care about what their donors think. And that includes small donors. Like I occasionally give $50 here and $50 there. And that does create a little bit of a relationship with a legislator. So that's what I mean when I say donors, anybody at that level and up. And then volunteers. So the people who maybe came out and door knocked for them, or made phone calls for them, or did any number of things for them during their last campaign. They also are influenced in some cases by lobbyists, both grassroots and paid lobbyists, and we'll talk a little bit more about that distinction later. Ads aimed at their district. You will see a lot of ads. If you're on social media, they can geofence or geo-target ads now so that you can pay Facebook to put up an ad just in this one zip code. So people that live in one zip code are going to see an ad that says, tell Representative Johnson to vote yes on Senate File 1234. And that actually, like, they see those, and those really influence them a lot. Sometimes it influences them and makes them angry, but sometimes it influences them to do what we want. And then lastly, another really important influence is whoever are the biggest employers in their district. They're going to listen to those folks. I'm going to talk briefly here about what doesn't influence them. They're usually not very influenced by people from outside their district. So I live in Minneapolis. If I go to visit Representative Johnson and she is from Thief River Falls, she probably does not care much what I have to say. Now, as one of 67 senators or 135 representatives for the entire state, they should care what everyone from the entire state thinks. Some people do, but I think most of them really are want to just hear from their own constituents. They're not usually influenced by a lot of information and data. They want to hear stories. Some of them really love, are a little nerdier and do want to hear all that data, but for the most part, they want to hear stories. They are not influenced by conversations that they think aren't relevant to the work that they're doing. So you know that if you go and talk to any one of those legislators, that healthcare is critically important and it is relevant to everything else that happens in the state. Now, they may think, well, I'm not on the healthcare committee, so this isn't relevant to me. That's unfortunately, you might hear that from some of them. And so it's going to be your job to make sure that they know that, no, it is really important, even if you're not on the healthcare committee, and this is why. And then lastly, arguments that don't fit with their ideology. And I think everyone knows that a lot of elected officials now are much more ideologically driven than they probably were 20 years ago. And they are less likely to have their minds changed if the argument, especially if the argument really conflicts with the ideology and what the story is that they are telling themselves about why things are the way they are. So it's just something to keep in mind. And with those folks that are very ideologically different from us, I think that's a lesson in knowing when you need to call it quits. We should never just skip anyone. They have to hear what the stories are from people in their districts about what's happening with healthcare and why we need to do better. But at some point, you realize you're not going to get everybody on your side, and there are some people you're never going to convince. And so it's probably for the best to move on. All right, now we're going to pause for a second, and we'll ask Rose to come back, and she is going to talk about the actual policies that we're going to be lobbying on. And then when she's done, I'll come back and finish up.
Awesome. Thank you, Jerry. Hi again, everybody. So I'll just take us through sort of a little bit of ground setting of why we're supporting the bills that we're supporting. Then I'll walk through those bills and we will absolutely be able to take some questions here at the end of the training. So don't worry about that. So you can go to the next slide, Jerry. So I just think that this is always so shocking when we look at what the headlines are telling us about our healthcare system these days. I think it makes it very clear as to why we're choosing the patient-centered care bill, the state prescription drug purchasing bill, and the medical debt Reset Act as three of the major bills we're asking to get passed in this next session. And then, of course, ultimately, the Minnesota Health Plan. When you have a healthcare system that has headlines like this in the papers here in the United States, health insurers gave $120 billion to shareholders while denying your claim. HMO profits from Minnesota state programs jumped to $675.8 million with enrollment surge. How health insurers racked up billions in extra payments from Medicare Advantage. It was stunning bipartisan anger aimed at Medicare Advantage care denials. Legalized racketeering, how PBMs skirt the law to rake in billions. And then United Health, employer of slain exec Brian Thompson, found to have overcharged some cancer patients for drugs by over 1,000%. Just this morning, I guess there was also another headline about Mayo making record profits in the Star Tribune. You want to go to the next slide? Because this one is the one that probably makes me the craziest. Goldman Sachs asking in biotech research report, is curing patients a sustainable business model? Well, I do not think that it's supposed to be about a business model now, is it? It is supposed to be about healthcare and healing people. So the next slide, please, Jerry. I wanted to just show this graphic as a means to give you a sense of how convoluted.
Rose, I'm so sorry to interrupt. Can people see the slides? Because I'm here. Oh, okay. So it's one person can't see.
Some others are saying they can't see now too. They just see me. Oh,
no. I can see it.
Okay, now.
Okay.
Yes.
Okay. So Karen, can you see now? Karen was the one who couldn't see. I just want to make sure she's good. And then sorry for the interruption, Rose.
Now I see you, but just a second ago, I did see a slide.
Okay. I'm going to stop sharing and then start again. We'll see if that makes a difference.
Problem.
Okay.
Sure.
I'll share one more time. All right. Can people see it?
Yes, I can see it.
I can see it. I can.
All right.
Yes.
Okay. So the next slide, Jerry. Oh, you are on mute, Jerry, and nothing is, there we go. All right, here we go. Okay. I'm just looking to make sure Yeah, please do let us know if you still can't see these slides. So this slide I'm showing you simply to give you one example of how convoluted on the one hand our system is, and yet how incredibly concentrated on the other it is as well, in what I would call a US healthcare marketplace, much more than a healthcare system. 7 large corporations pretty much control all aspects of healthcare except for providing actual care. They call themselves managed care organizations, but in reality, we know that they manage claims and they manage money. They don't manage our care. That's our care providers, our nurses and our doctors that provide us care. Because our system is all about making money off of our suffering, we're going to be focusing on bills that begin the critical process of moving the privatized privateers out of our public health programs so we can start to build the public health infrastructure that we will need for implementation of the Minnesota Health Plan. You can go to the next slide. All right, so bill number 1 is going to be the patient-centered care bill, which is authored by Senator John Marty in the Senate and by Representative Tina Liebling in the House. You see the numbers that are up there on the screen. So here's a little bit about this bill. This bill begins the process of moving Minnesota's Medicaid and Minnesota Care programs to what we refer to as a direct provider payment system. That means we are removing unnecessary and costly middlemen, the managed care organizations, or MCOs as they're referred to, and sometimes HMOs, getting them out of our public health programs. The bill also prioritizes funding for care coordination, collaborating with community clinics to do outreach to people who are not receiving the care that they may need. Here in Minnesota, many of you from Greater Minnesota in particular know that we have something called county-based purchasing entities. In the case of the county-based purchasing entities, just so you know, pretty much all of them already operate like this. They don't have an MCO or an HMO in the middle. They are doing direct contracting between the county and the provider. We're just saying, why not do all of our all of our public health programs this way, because there is no question that we are going to save money from all of the administrative waste that's baked into any time you put privatizers into the healthcare system. And we can use that money to improve benefits, expand care, and hopefully even improve reimbursement rates to providers, because we all know that Medicaid reimbursement rates to providers is way too low and needs to be looked at. As we are facing these draconian, drastic, and I think I heard yesterday Don Berwick, who used to head up the CMS under, I think, President Obama, said the murder bill that will take away, billions of dollars from our Medicaid program. This is one way in which we can start to look at how to, we're not going to make up for all of it, but we can certainly streamline, be more efficient, and use the money in the healthcare system for actual healthcare instead of for things that are not healthcare and going into the pockets and the bank accounts of the insurance companies. As rural Minnesota struggles with a healthcare crisis, driven mostly by corporate healthcare prioritizing their bottom line over the health needs of the rural community, we know that there is bipartisan support for the county-based purchasing model. So we are cautiously optimistic that this bill may get serious consideration and debate in the 2025 and 26 session. Now, I want to put a little disclaimer on this. There was just yesterday morning, there was a hearing on this bill. It was an informational hearing in the Senate Health and Human Services Committee. It was a really good, you can get the link, listen to it if you'd like to. It went for an hour. Senator Marty thought he was only going to get 15 minutes. But the reason I raise that is because there is a report you may all recall is going to be coming to the legislature in January of 2026 from the Department of Human Services that specifically provides the legislature with plan options for moving to a direct payment, provider payment system. And so there are some legislators that don't want to necessarily heavily debate and pass this just yet. They want to see what that report looks like. Senator Marty is working to actually have this system, the patient-centered care model, modeled in that report that, or those plans, excuse me, that are coming back to the legislature next year. So this is nothing you're going to have to talk about when you talk to your legislators. So don't worry about that. I'm just giving you a little bit of inside baseball and some background on how things are going in the legislature. We might not get a hearing in the House on this year, but that's okay. This is meant to help educate both the legislators as well as the public on how setting up this kind of a system would be beneficial for everybody. Connecticut did it 12 or 14 years ago. They have saved a boatload of money. Providers love it because they don't have all of the in-betweens to have to deal with. They have a much easier system for providing people care, and patients feel exactly the same way. So it's been done before. We can be the next state to do it. Makes perfect sense for us to do so. Go ahead, Jerry, to the next one. The patient-centered care bill that I just talked about is about structural and systemic change. And it is an important step in building the public health infrastructure as we create the conditions necessary for the Minnesota Health Plan. Another step in building the public health infrastructure is Representative Liebling's state prescription drug purchasing bill, HF 1093. A state prescription drug purchasing bill under which all the pharmacy benefits would be run through the Department of Human Services, removing the managed care organizations and thereby removing the pharmacy benefit managers known as PBMs, yet another middleman. This bill, which is also included in Governor Walz's Health and Human Services budget, is supported by the Minnesota independent pharmacists because we know that independent pharmacies are becoming extinct due to the mergers of chain pharmacies with health insurance companies and the insertion of yet another middleman into the system, as I said earlier, the pharmacy benefit managers. And this is causing the closures of most family-owned small community pharmacies, particularly in the rural areas. This is most prevalent, as I said, in rural communities, and it's one of the main reasons the independent pharmacists really want to remove those PBMs from our public health programs. And this bill does just that. This bill has the potential for bipartisan support. Again, we believe, regardless of political party, we know that, particularly in rural Minnesota, many people are deeply concerned about their constituents' access legislators are concerned about their constituents' access to life-saving and life-sustaining drugs. So this bill is another important step in the right direction. You can go ahead, Jerry, to the next one. So while structural and systemic change is critical, so is harm mitigation in the current, milieu that we're in here. So we must do some things to help people now. Thanks to Attorney General Ellison, who worked with Senator Bolden and Representative Reier in last year's legislative session, Minnesota has made significant changes to help individuals and families deal with medical debt, which shouldn't even, by the way, be a thing, but here we are. Those changes included the prohibition of medical debt transferring to a surviving spouse. Medical debt no longer can be reported on your credit reports, and they also lowered the percent that could be garnished from wages or taken from your bank account to pay back medical debt. We know that medical bills are the leading cause of personal bankruptcy, affecting the middle class the most. Even those with health insurance carry medical debt, and the fear of that debt causes people to defer or skip treatment, which can, of course, lead to worse or more costly health outcomes. Attorney General Ellison worked again this session with Senator Bolden and Representative Reier on medical debt, and they are seeking a $5 million appropriation to purchase an estimated $500 million of medical debt and then to forgive that debt. This would be done through a nonprofit organization called Undo Medical Debt and would impact between 250 and 400,000 Minnesotans. Go ahead, Jerry, you can go to the next one. And then we will, at the very least, leave information on the Gold Star, the Minnesota Health Plan. I think everybody is pretty clear on what we want and why we want it. And those are some of the basic principles and founding governing values of the system. We're going to leave behind an informational piece. The ask is going to be simply to ask the legislators to please jump on as co-authors of the Minnesota Health Plan this year. So that'll be an easy one. You can go to the next one. So cost containment is key to achieving universal coverage, but trying to use the current system to get to universal health care won't work because the system is just too expensive as it is currently designed. We can make it politically feasible to get the cost of care down without adding complexity and fragmentation, which just increases cost. This is what our current system looks like. Hit the button there, Jerry, and the system we want should come up. We can replace that convoluted system with the one we know will do the 4 things we want from a healthcare system: cover everyone, save money, improve quality, and most importantly, save lives. And that system is the Minnesota Health Plan. So if you go to the next slide, you can see here on the next couple slides, these are literally taken off the sheets that are going to be in your packets on Monday with specific talking points for each of these bills. They're going to be very straightforward. We will, there's an opening paragraph for each one of them that just explains a little bit about what the bill is, highlights 3 things that are really important that we want legislators to know, and then summarizes why we want them to sign on and ask them to please support the bill. So you can see that here for the patient-centered care bill, for the state prescription drug purchasing bill. And then if you go to the next slide, it's the other 2, which are the Medical Debt Reset Act and the Minnesota Health Plan. And it's very straightforward. It's pretty easy to do. If you're in groups of, 2 or 3, everybody could take a bill and choose to just, read right off of those talking points. It's going to be fine. And if you get a question that you can't answer, you respond by saying, I don't happen to know the answer to that question right now, but I will find out for you. I'm making a note of it. I will turn it in, and someone from Healthcare for All Minnesota or PNHP will be contacting you with an answer within the next couple weeks. And then just make sure we get that return form, and Jerry's going to go over that in a little bit as well, so that we get that form and we can be sure to honor that promise and follow up with that legislator or their staff to let them know what the answer to their question is. You don't have to know every single thing. And I really want to emphasize that we are going in here on a positive note. It is hard right now, for me it is anyways, to be terribly positive. We are bombarded day in and day out with what I think is some pretty scary stuff. But you know what? We have to have hope, and we have to provide hope. So this is all about offensive legislation that speaks to the needs of people and human beings and our humanity. And I think that is a winning message for us. And I think it's uplifting for us to be going in and talking about very positive things that can help one another. You can go to the next one, Jerry. So the healthcare system, as we know, is in crisis right now, with more and more people being denied the treatment that is prescribed by their doctor, more and more corporations gobbling up hospitals, clinics, and pharmacies, more and more families faced with bankruptcy due to medical debt, with AI algorithms taking the place of our highly skilled healthcare professionals. All of this, as our life expectancy plummets, will corporate health insurers and pharma profits soar. It is pretty clear that we can't keep tinkering. It's time to get to work to create the conditions that make achieving a healthcare system that centers patients, providers, and patient care as our reality. And that's why we chose these bills to highlight for our lobby day. Thank you. And I said we'll take questions at the end, everybody, so don't worry.
All right, great. Thank you, everyone. I was watching the chat, and we did have one question about what is the role of the authors and the co-authors of a bill. And so I'll just try to touch on that quickly. The chief author of a bill is a lot of responsibility, and that person has to sort of be the main presenter, spokesperson, negotiator to make sure that bill gets through committees and floor sessions. It's a ton of work. And co-authors, there's not a ton of responsibility on them. They just kind of have to vote for the bill. Now, if they choose to do more than that, they can. And some of them take it very, very seriously, but some of them, they sign their name and they're kind of done. So it really depends. All right, so we're going to dive into now what is lobbying and what does it mean to be a grassroots lobbyist. So this was these memes were going around a few years ago. being a lobbyist does kind of feel like this most of the time. You're working really hard and you're tromping back and forth to the Capitol and just having a million conversations and researching and writing and phone calls. And it does feel like sometimes pushing a boulder up a hill. And lobbyists sometimes get a bad name in our society. So I want you all to go into this knowing that you as a grassroots lobbyist are one of the good ones. There are good lobbyists out there that are paid. They work for organizations like membership groups, which is what I do. They work for labor unions, they work for think tanks and so forth. But they don't have corporate money. So for example, a big hospital might have, 10, 15, 20, 80 lobbyists. And a union representing nurses, for example, might have 2. Or a group representing Healthcare for All might have 0. And so those kind of more grassroots groups, democratic membership groups, they really depend on grassroots lobbyists in addition to or instead of paid lobbyists. So your job is really important. What a grassroots lobbyist does is very similar to what a paid lobbyist does, but there's one really important distinction. So one job that both do is sharing the organization's position on a bill or an issue. That's the basic. So you're going in, you're talking about what are the priority bills? What do you think about the way things are going and how they should be addressed? You are then responsible for gathering information and intelligence. So you're going to find out who has concerns about the bill, who knows the most about this bill and can help get it passed, who's out there trying to throw a monkey wrench in the way of your bill. And so you're gathering information and intelligence from these meetings and conversations you're having. And then another job of a lobbyist is building relationships with legislators. And that is where really good work can get done when you have a relationship that's built on trust and built on sort of collaboration with a legislator. You can get really great things done. And you could be a paid lobbyist or a grassroots lobbyist and have that. The piece that is different for a grassroots lobbyist is you also have the job of holding them accountable, because presumably you're going and talking to your own legislator. So, a paid lobbyist might have some campaign dollars to give after session. You come with voter accountability. So you're basically at the same time you're doing all of the rest of your job, you are sort of conducting a job performance review. So think about how it's worked at jobs that you've had. You want to know how you're doing. So you want your boss to bring issues to your attention and bring you opportunities to learn. The best bosses communicate frequently and openly with their employees. So that's kind of what you're doing when you are meeting with your legislators. You might not have big PAC dollars. If any of you do have big PAC dollars, I would love to get to know you better. But you probably don't have big PAC dollars. But if you meet with your own legislators, you actually bring electoral consequences with you. And some of these seats have been won by as few as, I think, 20 votes. So it really does matter at this level of government. If they have 10 constituents in their office talking to them about something, that is still a big deal when you think about how slim those margins can be. So I just want you to go into this knowing that you have a really important role and you do come into the room with credibility and power. So meeting a legislator. And I know a lot of you said you were first timers. I just want folks to know, don't be intimidated by legislators. They are regular people. They are teachers, doctors, lawyers. We got a couple of nurses. We got some insurance agents. We got a department store worker. I mean, these are people, there's some farmers, people who've done all the gamut of jobs. And you may actually know more than they do on this issue, especially if they're not on a health committee and they don't talk about this stuff every day. So don't be intimidated. Most of them are very, smart and competent and wonderful individuals. Some of them are not the sharpest knife in the drawer, and some of them just don't know what they're talking about regarding healthcare. So you're probably coming into this meeting with more knowledge and expertise on this issue than they have, unless they sit on a healthcare committee. And even so, you still might know more than they do. This is a video that I borrowed from the Minnesota Nurses Association's YouTube channel that they created a few years ago, and I'm crossing my fingers and hoping you'll be able to hear the sound. Let's see.
Can't hear sound.
Shoot. Okay, you can't hear the sound? Let me
No,
see if,
we didn't hear anything.
okay, hold on, and let me see if I mute myself and if it makes me.
Nope, still not. I'm not, unless other people are. Did you do the whole thing with the
It's,
Zoom?
yeah, no, I didn't. Okay, you know what, folks, we're gonna send this out. We'll send out the slides to you afterwards, and you can go and watch this delightful video yourself. It's just a really quick do's and don'ts. So yeah, don't try to buy their votes. Oh, come on. Okay, so we'll talk through what it's like during these meetings. So the meeting agenda, before you go to your meetings, and I assume that the meetings are all set up already for you. They might get moved around because their legislative schedules are very fluid and things change. So you might have to, be a little bit flexible, but you'll have your meeting set for you. You're going to get together in groups before you go to your meeting, and you're going to pick somebody to be a facilitator to kick off the meeting. Like Rose talked about, you're going to decide, before the meeting, who's going to talk about what. Who's going to talk about the prescription drug bill? Who's going to talk about the Minnesota Health Plan, et cetera? So, work all that stuff out. Maybe even practice your pitches with each other before your very first meeting so that you can just kind of feel more confident about what you're going to say. So during the meeting, you'll probably have, 15 minutes is roughly what they schedule these meetings to be. So you'll start with a round of introductions. Your facilitator will say, good afternoon, Representative Johnson. We're a group here from Healthcare for All Minnesota and Physicians for a National Health Program. And we are here to talk to you about healthcare justice. And then everyone will say their name and where they're from. And then you're going to, describe why you're there. You're going to talk about the bills. If you have time for a personal story that corresponds to the bills, it's really a good idea to tell personal stories because, as I said, that's what they really want to hear about. That's what sticks in their minds, just like with anybody. I'm just, just regular people. If you tell me a story versus if you show me a graph, I'm going to remember the story more than I'm going to remember all the data. Then you're going to make a hard ask. And what that means is you're going to say, these are our bills. Will you support them? Will you vote for it in committee? Will you co-sponsor this bill? And then listen for their response, because that is going to be the most important information. That's where they're going to tell you. If they tell you yes, well, that's fantastic. That's wonderful. They might then share with you more about why they care about this issue. That's really important information. You remember that. If they tell you no, or I'll think about it, see if you can get them to talk about what's holding them back. Maybe they have a concern that is completely unfounded and you'll be able to dispel that concern and they'll say, oh, okay, great. Well, where do I sign? Maybe they have a concern that's going to require you to go back and get more information for them. But knowing what their concerns are makes it a lot easier than for the organization to come back to them later and say, we heard what you had to say about the issue and we think we've tweaked the language in the bill and now it'll be more acceptable to you. So this is a really important part of the meeting, is really listen to what they have to say when you make that ask and then take notes about it. Maybe wait until after you're done in the meeting, take notes about it. If they do have questions, like Rose said, and you don't have to answer them, just say, I'm a volunteer. In my daily life, I'm a teacher. I make, bread. I do whatever. I will find out that answer to you, and either I or somebody from Healthcare for All or Physicians for National Health Program will get back to you. And then follow up, because information to them there's a saying at the Capitol, information is like currency. So if you get them a piece of information they didn't have before that helps them do their job, that's a really good thing, and they'll remember you for that. And then thank them for their time. Always say thank you. They're really busy. They are working from sun up to sundown, some of these folks, and it's a really punishing schedule. So thank them for their time and ask to get a photo with them. Get a nice group photo. Those are always good to have. After the meeting is over, you're going to debrief with your team. Talk about how do you think that went? Everybody hears things in meetings a little bit differently, so it's a really good idea to compare notes. So I might have heard Representative Johnson say, I love this bill. It sounds great. I'm totally on board. And if I went to that meeting with Rose might have heard that person say, well, you know, I really do like the idea of universal health care. I'm with you. Those, you know, those are two very different interpretations of the same conversation. So you really want to get to the bottom of what that person is thinking. So compare notes with each other after your meeting. Report back to the folks that are organizing Lobby Day. So there is a report form. We'll go over that in a minute. And then if you did take photos, share those with the folks who organized the event too. So your elevator speech. This is in case you don't get your 15 minutes. This happens sometimes because, as I said, the schedules at the Capitol can be fluid and very busy, and these folks are going to get scheduled for things one on top of the other. So you might only have enough time to talk to them in the hallway for 5 minutes, or to walk with them from meeting 1 to meeting 2, or you know, just the time it takes you to ride from the elevator on the 1st floor to the 5th floor. So that means you have to have an elevator speech just in case. So this is a very condensed version of what you would have said in your meeting. And so it's a good idea before you have your first meeting to get together with your team and practice what you're going to do if you're in this situation. So you need to have a concise, specific, quick speech, a few sentences. So practice before the meeting. And this helps you really tighten up your argument about what you're going to say. And in a lot of cases, it makes sense to only have one person do the talking. So if you want to sort of nominate somebody in your group, like, hey, if we only get 2 minutes with Representative Johnson, who's going to be our elevator speaker? And then that person can very quickly, pop out the elevator speech. So I do want to talk a little bit about different approaches for different legislators. So you're going to have folks who are super supportive already. So people like John Marty, who obviously is an author of the Minnesota Health Plan. He has been tirelessly working on healthcare justice for decades. These are the folks that when you talk to them, you're going to ask them for advice. You know, they already know the bill. They already support the bill. They are already with you on, you know, if somebody is with you on all 4 of these bills already, or even 3 of the 4, you know, definitely educate them on the ones they don't know about yet. And then ask for advice. Who else do you think we should talk to? Is there somebody else in your on the committee that you think might be convinced, you know, we could be convinced to support you, this bill? What arguments are most convincing to those colleagues? They'll understand what makes their colleagues tick. They might say, oh, well, yeah, my colleague Representative Smith over here used to sell health insurance. And so he really wants, you know, to talk about the cost of premiums. So, you know, that'll help you tailor your argument. Also, when you're talking to somebody who's already very supportive, share information and stories that will help them advocate for the bill. So when they are presenting their bills, they're going to be able to, you know, look back in their memory and say, oh, yes, I remember when I had a meeting with my constituent, Rick, and he told me all about what it was like for him after he had an illness and had hospital bills and got the runaround from his health insurance company. So share stories with them that help them to advocate for the bill. And then offer support for these legislators. They do work really, really hard. And these are punishing jobs. Everybody's yelling at them all the time. It's not a fun time to be a legislator. So offer them support and ask them, what else can we do to help you move this bill forward? And they might say, oh, you know what, it would really help me if we could get like 20 people to call my colleague, Representative Jones, in support of this bill. Really would make a big difference if he heard from his constituents on this bill. just offer to do what you can to help them push this bill forward, and then thank them. Obviously, they're our supporters. We love them. Love them all. Sorry, my dogs are. If you're talking to somebody who's wishy-washy, I'm going to close the door here. Hold on just 1 minute. I'm sorry. Shh. Hey, shush. Sorry. If you are talking to somebody who is wishy-washy, it's really important to make the hard ask and not let them weasel out of it. So, will you support this bill? Will you vote for it in the hearing tomorrow? Will you sign on as a co-sponsor? And, if they say, oh gosh, I think it's a really cool bill, like really try to get them to yes. You might hear weasel words, which when people say things like, oh, I'm with you in spirit, I really like this idea, or I really think universal coverage is important. None of these are commitments to the things that we're talking about. So ask them more questions. What's holding you back from signing on to this bill? What other information would help you to feel comfortable voting for this bill? And really try to tease out what is it that is keeping them from supporting it. And then again, thank them no matter what, even if it was unsatisfying, even if you felt like, oh, they're not doing enough. Just, I like Gina. I like what you have to say in the chat. Unfortunately, I don't know that that'll help you in the long run, but I think you can say that to each other in your debrief afterwards. But always say thank you, because you just never know. Somebody might have a light bulb moment and be your best friend next week and your greatest champion for your bill. So thank them. Always end it on a positive note. If they're an opponent, as I said before, we're not giving up. We're not going to just write anybody off. We are going to go visit every legislator we can. And regardless of their party identification, regardless of what they've said in the past, it's really important to keep working on some of these people. So always be nice, even if you think they're just a jerk. You got to be nice. And I had an old boss of mine who used to work for a state senator, tell this story. She saw her boss, who at the time was like chair of the finance committee, so like one of the more powerful people in the legislature. And then he was running down the hall, and there's these people running after him, yelling at him, and they have signs on sticks, which they don't let you carry in the Capitol anymore. And they're yelling and like shaking these signs. And he like ran. She quick opened a door for him, like to a side door to a office, and he ran in there. And then the angry people with the signs ran the other way. And if you think about that, no matter how righteous the cause of the people with the signs, do you think that legislator will ever listen to them again? No, never. And so even if you think that this legislator is the worst, you got to be nice. And it's hard. It's harder now than it's ever been, I think, to be nice to some of these folks. But you got to try. Talk to them about the local impact of the bill. So talk to them about the local hospital, the local nursing home, how it affects the jobs that those places create, or what cuts are going to do to seniors in your community or to people on fixed incomes. Talk about the local impact on your district. That should still matter to them. Don't fight with them. Don't debate with them as much as we would like to. It's not usually very effective. And just look for common ground, and you may find it. It's still good to try to find common ground with somebody on something that you can agree on, because again, you just never know when you might end up on the same side of an issue with them. It's politics makes strange bedfellows. That's the saying for a reason. You might find yourself on the same side, for a different bill. So maybe it's not the Minnesota health plan, but maybe this legislator is going to be really, really interested in a new bill about prescription drugs. And so you always got to keep that line of communication open. Yeah, Diane said in the chat, there are no permanent enemies and no permanent friends. I've personally encountered a legislator I thought was totally opposed to all my issues, and I found that he was on my side on one issue. So yeah, you gotta keep the door open to those kind of possibilities, and there are those pleasant surprises every so often. So this is your report form that you're going to fill out after your visit. So your legislative visit guide / worksheet. And I know that it is really hard to see this. I don't think I can increase the size though. So you're going to have this in your packets. You are going to fill this out after every meeting. And your organizers have created a very thorough worksheet. Trust me, if you can't see it because it's too tiny on the screen, it's going to have you, fill out first the roles of who's going to be your facilitator, who's going to be your note taker, who's going to talk about the various bills. And then it's going to ask about the patient-centered care bill and the notes. Will the legislator support the bill? Will the legislator co-sponsor it? Then there's a section for the drug purchasing bill and a section for the Medical Debt Act, and then a section for the Minnesota Health Plan. So this really does take you kind of right through that agenda for the meeting and gives you places to fill in, the important information that you learn about where the legislator is on each of those bills. So next, I just want to talk quickly about, Anne is saying in the chat, I'm hoping if there are enough people in the group, a note taker will complete the form as the visit goes along. So that is an option. I think, how many minutes did you say we have? Most appointments are going to be 15. Yeah. So do take notes. Some people can remember things in their heads. I'm definitely somebody who needs to write things down on paper. So, but know that you have that worksheet to kind of guide you through the conversation, and then you fill it in when you're done so that you can get all that good, juicy intel all in one place. So just going back over really quickly, some do's and don'ts. Share your story. They will remember stories. Don't make them too long. Make sure that the story is connected to the bill you're talking about. And a story is how this issue affected me, a single individual person who lives in your district. It's not, well, in Canada, they do this, and this is how this funding stream works, and this is how blah, 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 blah. That's not a story. And sometimes that's useful information, but it's not what they're going to remember. So tell a personal story. Follow up. So if you said you were going to do something for this legislator, either do it or ask somebody at Healthcare for All or PNHP to do it, and then make sure it gets done. Because that's, nobody likes it when somebody promises them something and then they drop the ball. So follow up. Develop trust. So this is, again, like, be honest. Don't make up answers to questions. Give them, honest answers to things, and be honest if you don't know something. When you do follow up on something you said you're going to follow up on, that builds trust. Talk about the impact that your legislation will have on the district where you live. Be nice. I know I hammer on this one a lot, but it's really important. And always make the hard ask about a bill and listen to their response. Some don'ts. Don't assume anything about a person. You just don't know. Especially, there's a lot of newly elected legislators, and some of them have personal experiences that might make them more likely to, listen or be receptive to our message than you might think, based on their, profession or their party affiliation or whatever. So just don't assume anything. Don't lie, don't make things up or guess. So if somebody says, how much is this bill going to cost, the state over 2 years? Don't be like, what? I think it's $6 billion. Don't make up numbers, just, again, say, you know what, I'm a volunteer. I'm going to have somebody else get back to you on that. Don't be mean. Don't chase them down a hallway. Don't make threats. And you definitely can't tie their vote to a resource. So if you say something like, if you don't vote for this bill, I'm going to get you, or I'm never going to, I'm going to tell all my friends to come and get you. Like, don't do that. Don't say, we'll never give you a PAC donation again. I don't know if you're one of those people with a great big political action committee. Don't tie votes to resources. That's not really a good idea. Don't overwhelm them with data, and don't let the meeting go off topic. A lot of times legislators that don't want to talk about something because they know it's not what you want to hear will try to steer you into a different topic. And so they might not want to talk about healthcare because they don't agree with you. So they're going to say, oh gosh, you know, I just got us some funding to rebuild the sewers in our town. And let me tell you, we're going to have the best sewers you've ever seen. And, you know, that's really nice, but that's, you know, Senator so-and-so, we really want to get back to talking about healthcare. We're going to look forward to those new sewers. So try to keep the meeting on topic. And that goes for participants too. Sometimes the participants get really excited about the sewers as well. And so make sure your teammates all stay on topic. And then just extra credit, you know, beyond just a 1 day of lobby day, you can really be working on building a relationship with your legislator. So check in with them frequently. Call them, leave a message, send them an email every so often. Thank them when they do something you like. You know, if you saw that they voted for a bill that you cared about in committee or on the floor, email them and just say, thank you for your vote. That was really great. Sign up for their email newsletters. Almost all of them, I think, have an email newsletter. If you're not getting yours from your legislators, sign up for those. And so then they'll tell you when they did things, and then you can respond back. Oh, I'm so glad you supported that bill. And if they did something wrong, you know, send them a note. Oh, I'm really disappointed. Really wish you'd have supported that bill, and I hope we can work on this in the future. And we can tackle this issue. Attend events in the district. These folks live in your neighborhood. If you're in the cities, if you're in a rural area, they live in your town or the next town over probably. So attend those town halls, meetings. If nothing's happening, host one yourself. I know that you can get a legislator to come to a local coffee shop if you can promise them, 5 or 10 of their constituents will be there. And that's a lot easier than, depending on how far you're away, getting people to come to a local coffee shop is easier than getting them to come to the Capitol. So that's something you can do. And then get involved in the off season, go to caucuses, even though none of the legislators are going to be up for election this year, they'll probably all be at their caucuses. And so if you are a caucus goer, go meet your legislators there. It's maybe a different environment. You might have a more friendly conversation there. So that's always a good opportunity to talk to decision makers. And then if you're able, attend a fundraiser. They, unfortunately money does talk, but even if you do make a small donation, they do remember those folks. And we do still have the political contribution refund in Minnesota. So I think it's now up to $75. If you donate $75, the state will reimburse you. And then, ultimately the goal of building these relationships is you become the person that the legislator calls when they want a gut check on an issue. So they've identified that, that Ann Jones, she seems like she's pretty sharp. I'm going to call her anytime something comes up about healthcare justice because I really want to know what she thinks. And I've seen this happen where people have, met their new legislator, and then over the course of a session or two, they really do build a trusting relationship where that legislator will call the constituent. You don't even have to be the one to call. They call you and say, what do you, somebody is proposing this. What do you think? And because you probably have more expertise on the issue, you can tell them what they think and they'll do what you want. This is really great. And so the goal is to have all of you be that go-to person for your legislator. Now we have reached the portion that everyone has been waiting for, the question and answer. I'm going to stop sharing so we can all look at each other. All right. Who has got questions for me or Rose? Judith has her hand up. Go ahead, Judith.
Yes, I have 3 questions. The first one is, when will you send the slides? Because I would like the slides tomorrow to give me a little time to look over them. I don't want to get them on Sunday or Monday morning. That's too late for me. I need things beforehand. That's question number 1. Question number 2 is, would you please review some of the questions on the chat? Because I listen, I don't follow the chat. Okay. If there's something that we should know from the chat, I would appreciate that. The third thing is, we're sitting right next to United Health. I have 2 people on my block that work for United Health. I mean, I don't know how to, I think that's something we really need to address.
Rose, do you want to talk
Sure.
about that?
So Judith, so the first question was answered in the chat. You'll get the slides tomorrow. I wish I could tell you, and I sent a text message, Bahia, to you and to Anne, because I don't know that this is possible. We're pretty overwhelmed. You know, we're all doing this as volunteers, right? And there's a lot going on going into Monday. If it's possible to send you all the handout and the talking points that'll be in the packet, that will be great. But if you get the slides, just so you know, those slides literally were taken directly off of the packet content. So if we can't actually send you the, handouts, you'll at least be able to, put that slide up big on your screen and look at it and read through it. And that should really help you there. Your second question was about what's in the chat. There was a chat question that was asked if you were going to receive the talking points. I did say yes, you'll get them in your packets. I'm looking at other ones that were answered. The PowerPoint, you're going to get the PowerPoint, so we've already answered that one. How many authors do we have now? It turns out, so in the Senate, you can have up to 25 authors on a bill, only 5 per bill. So what they do is they call them clone bills. So like the Minnesota Health Plan is Senate File 929, but there's also Senate File 930, 931, 932, 933, and they're all the Minnesota Health Plan, because you can only have 5 authors on a bill, and you can only have up to 5 total bills, right? So there's 25. Those are filled, but it still doesn't hurt us to say, will you author the bill? And if they say, well, I think the bill is full, you can say, oh, that's really exciting, but would you just let Senator Marty know that you were interested in, co-authoring? Because that just adds fuel to the fire, right? We know we've got more supporters, and that's always a good thing. So it never hurts to ask them, even if the bills are full. And the House is like 35, I think it caps out at. It could be all on a single bill. They don't do that clone bill thing, but they max out at 35. But I have approached, Representative Kayla Berg last session to say, Kayla, I don't think you got on the Minnesota Health Plan. And she said, I know I was too late. That had all 35 already filled, but we knew that Kayla was supporting the bill. So again, it's a conversation starter, if nothing else. So let me just see if there is another question I can answer.
And her other question was about United Health, and I thought there's been a lot of work around United Health via People's Action, and I know Rose has been at many of those events, and so I thought maybe you could talk a little bit about that.
We're not raising United Health in this at this lobby day because United Health right now, they're battling in the courts about whether or not they're going to be involved in the Medicaid program and the Minnesota Care program. We're just kind of keeping it, basically any type of an entity like that is not good for our public health programs. So yes, there is stuff to do on United Health. We can't do everything in a single day at a lobby day, and especially when we only end up getting maybe 15 minutes with legislators. But believe me, we are engaged with the People's Actions Care Over Cost campaign. We continue to push back on, United Health every chance we get. We're doing a lot of education around Medicare Advantage and how awful United Health is in the Medicare Advantage field. But yeah, it's just not something we're going to touch on during this particular lobby day. Go ahead, Anne. Maybe you wanted to add to that.
So all the meetings are 15 minutes except for one. So you really have to, we scripted this as tightly as we could. Our Legislative and Policy Committee worked on each bill has about a 1 or 2 sentence intro, 3 talking points that you can just read right through, and then a sort of a summary. Each one is the same. There's a bill number so that you can tell them the author of the bill. They like to know that. And what you can do is have your talking points right in front of you. You've got your worksheet right here. Take a few minutes. We're going to seat you in your districts in the meeting room at the Education Minnesota building so that you'll know who you're with. And we've got it, and there's a line at the top. It says you need to put the name of the legislator who you're talking to, representative or senator, so you get 2 per packet. And then if there are enough people, assign a leader who will keep time. a note taker who will keep the notes, then decide who's going to talk about each bill. Now, if there's only 1 or 2 of you and some groups are small, you're going to be walking through the whole talking points thing yourself. Otherwise, there's sort of an elevator speech kind of in the middle of the page. The leader can just say Healthcare for All Minnesota, PNHP Minnesota, or nonprofit advocacy organizations. So you don't even have to come up with one. There's a little intro about our organization. Then literally it goes right through the bills in order. And the last, and then who's sponsoring, who's the presenter. So you can have your worksheet right in front of you. The notes, will you support? It says, will you support right on the sheet, and will you co-sponsor? So you can't miss it if you kind of use your tools. And then the very last thing is an ask. It's not talking points about the Minnesota Health Plan. It's just an ask. We will inform them that the Minnesota Health Plan has been reintroduced. Senator Marty, Representative Breyer, we need a bill number yet for the House side. We'll go, if we have it, we'll let you know. And then constituents will ask that the legislators support and become a co-sponsor. So a lot of the meetings are everybody's together, the 2 House reps and the 1 senator. Some are separate, but several of them are together. So you'll actually be talking to your whole delegation in one meeting. So people should go to both sides. They should go to the A side, the B side, and the senator. So stick together as a group. And we will talk to you more about that on Monday. Should I mention, there is parking behind the building, the Education Minnesota building. There is also a big pay lot over across the street, lot Q. And we'll give you more instructions about getting to the meeting rooms. I was at the Capitol today, in fact, walking around trying to find meeting rooms, and so I can offer some hints.
Wear comfortable shoes.
Yes,
We are
walking. Yes, the Education Minnesota building is it's a 3-block walk to the Centennial building, but it's downhill to get to the meeting. We'll give you more instructions about what to do at the Centennial building. And then the Capitol, there are tunnels. It's supposed to be a fairly nice day on Monday. It's actually a little easier to walk outside because you kind of know where you are. And then I looked at, how to get to rooms in the Capitol, and we can give you a little more detail on that day of. I think there will be leave behinds. So the talking points are the brief, that's what you talk about during your meeting. There's a leave behind for each bill that you'll be leaving with the legislator. You'll bring the talking points back with you and the worksheet.
And Ryer finally got a number on the bill, and it's HF 1812. So the Minnesota Health Plan is HF 1812 in the House, and it's already got a full contingency of authors. It's filled up at 35. And Sharon, to answer your question, no, this is Healthcare for All Minnesota and PNHP's lobby day. This isn't a Health Justice Allies lobby day or anything like that. This is specifically Healthcare for All Minnesota and PNHP's lobby day. And we certainly hope next year that it will be actually the literal campaign, the Minnesota Health Plan campaign, which will be all kinds of different organizations and individuals will be doing a lobby day together. But this year it is specifically Healthcare for All Minnesota and PNHP.
If you really want to get into, do a dive into this, you can go to the Minnesota Legislature website. When you get the slides, you'll see the bill numbers on that worksheet. I didn't have the House one though, so sorry about that. You could actually go and look and see who has signed on to the bill. Then you'll look really like you know what you're talking about, and you could actually say thank you to the people who have signed on.
And I also want to make sure that folks saw in the chat that Bahia has said that she is going to send everybody an email tomorrow that will also not only include the slides to this presentation and this information, but will also give you the link to how to just click it to go to our webpage, because all this information is going to go live on our website tomorrow. So you will see the talking points that is going to be in your packet. You'll see the handouts. You'll see the report back form. It's all going to be there for you to look at over the weekend if you want. So watch your emails for that, because you will be getting one at some point tomorrow with that information. And Oh, I was just going to simply say, I really do think, even especially for like elevator speeches or whatever, remember that these really catastrophic cuts that are potentially coming from the federal government on Medicaid, this is a great way to talk about if we have got to shore up these programs here in the state. One of the ways to do that is to streamline how we administer these programs. And if we can do that, we can save money that we're already spending and put it back into healthcare. That makes economic sense, especially in a time like this. You know, so something just that simple in an elevator speech. Are you worried about the Medicaid cuts? Guess what? 2 of these 3 bills will help us deal with that. We need you to look at the patient-centered care and the state prescription drug purchasing bills, because they will help us shore up our Medicaid program for people utilizing services in Medicaid and Minnesota Care here, right? It can be just that simple if you've got to, you know, say something in you know, a minute or less, because that can happen.
And that's a bipartisan issue. There was last week, there was a story about, it was either 12 or 14 Republicans wrote a public letter signed with their names and everything to Representative Tom Emmer expressing a lot of concern about cuts to Medicaid. So there are folks out there on the Republican side of the aisle who do care about Medicaid. So don't ever give up because of somebody's party affiliation. There's a, oh, sorry, go ahead.
Well, and preserving our local pharmacies, our corner drugstores is also, we believe is a bipartisan issue. Now, we were disappointed that one Republican dropped off the PCC bill because we thought that one would be something they would all, you know, would be appealing to. But even Grunhagen showed up at a big protest at Optum last fall and said, we need to put patients over profits. You're going to love this one. And we need to get the middlemen out of our pharmacy. It's just, I had to laugh.
This is why I'm talking about, you never know when you're going to find yourself on the same side.
And in fact, important to know, we have lost 2/3 of our local pharmacies in Minnesota over the last, I don't know, 10, 15 years. And most of them are in rural Minnesota. They can't compete with these, the terrible business practices of the pharmacy benefit managers and the big insurance companies.
Okay, I want to try to get to, we got 10 minutes left and I want to respect everybody's time. We got a bunch of questions now in the chat. So I'm going to try to read through them and then I'll quarterback them to whoever is best able to answer them. Liz asked, do members of groups all have the same legislators? And I think you said they're all going to be in the same Senate district. So you'll go to your own house and then the other representative from the other side of the district. So if you live in Senate District 60, you'll go to 60 and you'll meet the rep from A and from B.
Yes, most of the meetings are together, not all, but most. And you get an individual schedule.
Okay.
The day of.
Perfect. Then let's see, the next question here. We already covered who are we? We are Healthcare Minnesota and PNHP.
Oh yeah, wear your t-shirt.
Wear your green or blue or your t-shirt. Question from Adina about what about Governor Walz's gaffe on trying to cut chiropractic from Medicaid? I don't think I heard that.
I don't have a direct response, Adina, for that. I mean, we're part of the Medicaid Defense Coalition that, of course, is pushing back on anything that takes any sort of needed medical care away from Medicaid and Minnesota Care recipients and enrollees. So, I mean, I would be surprised if somebody would say, what do you think about that? I mean, you know, we don't have to be mean to the governor per se, but we can certainly say, look, medical care is medical care. And people need to access the medical care they need when they need it. And so we are telling you that if we could look at the patient-centered care bill and we could look at the, you know, prescription or the pharmacy cargo bill, which the governor put in his budget, by the way, we could start to save some money and we don't have to worry about cutting anything out. Maybe something like that. I don't know, I'm winging it here. I'm going literally off the top of my head. So if that kind of makes sense as a respectful response, because the governor is on our side on a few of these things. And so, you know, you're just always trying to play a little bit of a balancing act, but at the same time, it's okay to be mad that he would want to do that because we don't want him to do that. That's not okay.
There is no education. The education building is a block or so from the Capitol. There's an administration building in between. You used to be able to go from the admin building to the Capitol. You can't do that anymore. We're going to send you, the parking lot is behind the Education Minnesota building or to the east. There are two parking lots. We're going to send you out the door from the education building that you'll go straight down the hill to the Centennial building. That will be outside. And you can get from the Centennial, it depends on where your first meeting is. Some are in the Capitol, some are in the Centennial building, some are in the Senate building. So there's 3 possibilities. And the Senate building is to the east. You'll have to walk outside to the west and go around to the front door of the Senate building. Once you're in the Capitol or the Centennial building, once you're inside any 3 of those buildings, there are tunnels if you want to use them.
And there will be maps included in your packets as well to help you maneuver all of this.
Yeah, and my meeting with my reps is right away at 12:30, and then I'm probably available by 1 o'clock. I'm going to be in the Capitol probably to try to help people.
Yeah, and I don't know where my meetings are, but I will tell you that if anybody wants me, you know, if it's only you alone or you and somebody else, between me and Ann and a handful of us that have done a lot of this work before,
Yes.
you know, talk to us. Let us know when you see us on Monday or email us beforehand. I'll put my email again in the chat here. We're happy to join you. You know, if you would feel more comfortable having
Yes.
someone with, please don't, you know, let us know, and we will
Yeah.
try as best we can to find somebody to help and be with you.
And Mark Lebo,
Okay, so-
Mark Lebo said he's a floater. He's not going to do a visit, and that's Representative Liebling's husband, and he's done he's a PNHP Minnesota member and a physician, and he's done a lot of lobbying. He wants to go with people. So if there are a few visits that are only 1 or 2 people, and we probably have some extra people who could join you.
So we've got 5 minutes left. I want to make sure we get to Jerry's question about reinsurance.
Sure.
Because Governor Walz is asking to not support reinsurance. Is this something we want to bring up?
I don't think we have the time, Jerry, to bring it up. I mean, we really tried to say, what can we talk about, right? And we decided that we wanted to be on offense for a change. Instead of always having to be on defense against the bad stuff, we really wanted to talk about how things could be different and could be good for all of us, right? So if reinsurance comes up, I mean, we would support what the governor is proposing. So are the major other progressive organizations in the state, like Isaiah and Unidos and SEIU and MNA and all kinds of different labor unions. The idea there is that the insurance companies can reinsure each other. That they can pay a fee like they do in other states, and that fee goes into a fund. And if they get a high claim from one of their enrollees that they need some money to support it, they would get money out of that reinsurance fund. That, as opposed to giving them $500 million, which is what the bill says, $500 million over 2 years, $500 million. We've already given them over $1 billion since 2017, just to hope that they will keep the price of the premium at something affordable on the MNsure exchange. And needless to say, those, by the way, those plans are not terribly good plans. Most of them are 70-30 or 80-20 plans at best, meaning that's a lot of out of pocket for people after they've already put a bunch of money out on premiums. So yes, we want people still to be able to access that because that's the only access they have to healthcare for some folks. Don't get me wrong, but there's a way to do this that doesn't have the state coughing up $500 million that goes into the dark hole of the insurance companies. So if it comes up, just tell them we like what the governor's got to say. We think it's good. We're already on the record with the legislature opposing the reinsurance bill.
Great. The last Oh, let's see. We have a question about arranging carpools, and Bahia said everyone is going to get an email with the contact information of other people from their district. So you all should live in the same general area, so that'd be a good way to coordinate carpools. Besides by email, how will participants get a hold of packets on Monday? I assume you'll get those when you come
Yes.
to Education Minnesota.
Right, we want people to arrive at Education Minnesota by 10:30, so that you can sign in, grab a packet. We'll have a little, kind of continental breakfast type of munchies there for you. And we are going to have A.G. Ellison is going to visit us, and Representative Liebling and Senator Marty, if he's able. He's got a committee meeting that morning, but each of them will talk about their bills a little bit, so you'll have some perspective from the authors themselves. Then I will take a moment to walk through, again, just not to the detail we went through here, but I will walk through the talking points, answer questions people have, and then we will do some logistic stuff, and then we will send you off. So the idea is please, please, please plan to be at Education Minnesota by 10:30 in the morning, so that by 11 we get people settled in, we can go through the packets, and you'll have them and off you'll go. But again, you're going to get a link to look at the packet content tomorrow. But the hard packets will be given to you when you check in on Monday morning. And
right.
who approves MNsure rate? Yes, Adina, that's correct. It's commerce. Everything goes through commerce on insurance stuff.
All right. Well, it is 7:59. We have kept to the schedule. I appreciate that very much, everyone. It was so great to be with you tonight. I am so excited for your lobby day. I'm going to be at a different lobby day that day. So I will see you all in the hallways at the Capitol, and I wish you the very best of luck. Thanks so
And
much.
I just want to say, folks, we're going to be at the Capitol with a lot of other people. So just there's going to be rallies in the rotunda. And I think Jerry said is it on reproductive rights? Is that what it is? Rally that afternoon. So if that's an issue you care about and you're in between meetings, jump in and listen to what they have to say in the middle of the rotunda.
Yep.
So it'll be a busy, fun day, everybody. Thank you so much.
All right. Thank you. Take care.
Good night.